Hello, my name is Dustin Anderson. I'm a doctorate and athletic training student at Indiana State University. And today I'm going to talk about my injury prevention practices in my clinical practice. After reflecting on what I do and sort of what my mission is, I work with in the military setting, and after reviewing my job description and everything else, I would have to say that I don't practice injury prevention in my clinical practice. Not that I don't know what injury prevention is, what a good injury prevention program would look like. In my job description, it does say injury prevention as one of the things that I'm there for. But one of the battles that I've noticed and that I've seen, and some of my coworkers that have faced as well, is not every healthcare professional understands what injury prevention is, what it entails, and the impactfulness that it can have. Just recently, we had a discussion about how to increase our encounters. One of our coworkers brought up the idea of injury prevention to Captain Waltrip, which is our clinical coordinator. And from what I gathered, talking to my coworker and Captain Waltrip later, that they had a pretty good heated discussion of, yes, injury prevention is a medical encounter. It does have benefit. And after talking to both of them, I guess I had the luxury of not being in the heat of the moment per se. I think they were both right in the sense that I don't think my coworker presented it in the best way. I think if you're going to prevent injury prevention to someone, you need to have a justifiable reason of why you need it, what you're going to do, how you're going to measure it, what you're trying to change, why you're trying to change it, how long you're going to implement it for, and your evaluative processes to it. And I will give it to my supervisor. He talked to me and he was like, "Am I wrong in thinking that injury prevention isn't an encounter because they're not injured, a medical encounter because they're not injured?" I was like, in the truest sense, yes, they're not injured, but research shows if you squat, you have valgus collapse, or say you have poor cutting mechanics or poor landing mechanics, you're more predisposed to this type of injury. It's not necessarily that you're going to get hurt, but you're at a greater likelihood of getting hurt, and the more than likely the factors that predispose you to that injury are modifiable. So why not develop a system? Why aren't we implementing these things if we know it? And I think the biggest reason where I'm at is time. They're there for 9 weeks. They get the basic training, and most of the people that I see really haven't done anything athletic in their life. When I was at Fort Benning, they started a thing called FTU. So when they first get to Fort Benning, they go through 2 tests, one assessment, and depending on how they do with that, they will go to a 4-week prep course before they go to basic training. And I think that's the important thing. For injury prevention to really take hold, it takes time. And a lot of people are just honestly impatient and they don't want to do it. And it's either going to take a lot of time or you got to stick with it. You got to do it. Say like if you're in the collegiate setting, or if you're working with a sports team, if you identify people that might be, I hate to say it, a higher risk, but for lack of a better way to categorize it is, if they're at high risk for an injury, then it's been shown to that they're going to have to put some extra time into it. And it comes back to us is we've got to be able to sell it. And I think it comes back to having a well thought out plan. I think people go into injury prevention with the best of intentions, but they don't have a clear set out plan for what they need to do and what they need to accomplish. So in my clinical setting right now, no, I don't think I'm doing a great job with injury prevention. And looking back, it's just because I'm not made it a priority. I'm not put in systems, and I've not tried to talk to people to make it a priority for my clinical practice. So that's totally on me for knowing that it is an issue and that I have the ability to make an impact on it, but I've not taken the necessary steps to make it happen.